This Week in Virology, the podcast about viruses, the kind that make you sick.
Hi, I'm Rich Condit with Microbe TV, and I'm here at the HBV International Meeting in Chicago. That's Hepatitis B Virus International Meeting. And I'm here with Chari Cohen, who is the current president of the HBV Foundation. And I'm anxious to learn all about Chari and about the HBV Foundation. And I'm starting from scratch, okay, because I know nothing, all right?
Absolutely.
So tell me about yourself, your history, and how you got into this.
Sure. So I got my master's in public health after college, and we all have to do a graduate research project. And I had previously been in molecular biology, so I had an interest in virology, and found the Hepatitis B Foundation, which oddly enough is in Bucks County, Pennsylvania, suburban area, not a place you would expect to have a nonprofit organization focusing on infectious diseases. But I called them up and I did a graduate research project with them, looking at the communications needs of people living with hepatitis B. And at the end, when I graduated, they said, "Why don't you stay on?" And that was in 1999. So
long time.
Yeah, I've been there. I've been there officially 50% of my life.
So have you been president there for that? No,
I've had just about every job while I've been there. I started as an outreach coordinator, moved into public health program manager, and then I was director of public health and then vice president. And I became president when the two co-founders retired.
Okay. So I want to go back and fill in a little more of this because the history went by pretty fast. Are you from Pennsylvania then?
I'm from Brooklyn.
You're from Brooklyn?
Yes, I'm a
I
Brooklyn girl.
immediately think of Marissa Tomei, right?
We went to the same orthodontist.
Is that? You came out of it without the accent, though.
So I went to college at Lafayette in Pennsylvania, and within 3 days, it became enormously clear that I needed to get rid of the accent. And by the end of the month, I was fine. So yeah,
Marissa Tomei tells a great story about her mother trying to get her to lose the accent, not knowing that it was going to be a moneymaker down the road.
If I were her, I would have kept the accent.
Absolutely. So, you mentioned an interest in molecular biology. So was that like, you said you went to Lafayette College, so is that where that happened?
Yes. So the great thing about being at a college versus a university is that undergraduates get research experience. So by my sophomore year, I was almost even running a lab, and I was lucky enough to work in a lab that was looking at the time, the effects of Taxol on cancer cells, and did my graduate thesis there. And then I did a 1-year fellowship at the National Cancer Institute in the pediatric branch, working on Ewing sarcoma.
Excellent. So that's all as an undergraduate, right?
Yeah.
So then what motivated you to go? You have a master's in public health.
And a doctorate in public health as well.
And a doctorate in public health. Are those degrees, where are they from?
My master's is from Temple University in Philadelphia, and my doctorate is from Drexel University.
Okay, and those are each, so you got probably a 2-year MPH program, and another 2-3 years on top of that for the doctorate?
So the doctorate, if you do it full time, is 3 years-ish, but I went part-time because I was working at the foundation and raising a family. So it took me 7 years.
So at what point then, so you went for your doctorate after you had joined the foundation?
Yeah. So what we learned was that as we were getting more deeply ingrained in public health research, to get NIH grants and CDC grants, to get federal grants, you really need someone who has a terminal degree. And I wanted to go back to school anyway. So the foundation supported me to go back and get my doctorate degree. And it allowed me to continue my work, continue my research, and it also allowed me to do my dissertation on hepatitis B.
So remind me again then, at what point in this whole journey you hooked up with the foundation?
Oh, or in my master's. I started at the foundation in 1999 as an intern. I graduated with my master's in 2001, and then I went back for my doctorate in 2007.
So was that connected with your master's program? Like you need to do an internship for the master's program?
You do. As part of the accredited public health MPH program, you need to do a certain number of community hours, and you also need to have a research project.
Okay. And you liked it, so you stuck with them.
Liked it and stuck with them. Yeah,
Okay.
it becomes, as I'm sure you know after being here for 4 days, it's very compelling. How do you not want to stick around and do something when there's so much need?
Right. So now tell me about the foundation. When was it started?
Sure.
How, by whom, for what purpose?
So the start of the Hepatitis B Foundation is really a love story. In 1991, there are the two co-founders, Joan and Tim Block, with another family. Dr. Block is a virologist, and he was actually here. He was working in herpes virus at the time, and his wife, Joan, who is a nurse, she was diagnosed with hepatitis B in 1991. And at the time, the vaccine was almost not used at all. There was no approved treatment. And they didn't know what to do, except they knew that she was at great risk of liver cancer and cirrhosis. And so Dr. Block said, well, I'm going to find a cure for hepatitis B. So they started the Hepatitis B Foundation, and he studied under Dr. Bruch Blumberg, who won the Nobel Prize for discovery of the virus. And they decided that he was going to start some labs and do cure research, and that Joan was going to work on the public health outreach and improve awareness among the key stakeholder groups. And they started at their kitchen table and have been really now we are the largest. In fact, we're the only nonprofit that is even globally dedicated to hepatitis B. And we're still the only shop in town, but we went from this small grassroots organization to now an organization that reaches 4 million people a year through our website and directly impacts about 20,000 people a year.
So you said Dr. Block himself was a researcher, right? And did you say he was working on herpes before?
Correct.
Okay, and so when this all came down, said, okay, bye-bye herpes, hello hepatitis.
Yeah, I'm going to cure my wife is what he said.
And where was he located? Where
Jefferson. At the time, it was Jefferson Medical College. Now it's Jefferson University.
Okay, excellent. And what a team.
Yeah.
You know, it's almost like I was just talking to Thomas too about he's a basic researcher paired up with a physician. Okay, but having that's like the hardcore local research and the nurse outreach stuff. Excellent.
Yeah, and it served us incredibly well because we're still today, we have a team of 10 public health researchers and public health program coordinators and managers, and we are right across the hall from the labs where at the Blumberg Institute, the science are still doing antiviral drug discovery. So it's an incredible collaboration.
So exactly where is home base?
We're in Doylestown, Pennsylvania, which is in Bucks County, about an hour northwest of Philadelphia.
Sounds beautiful. Is that right?
It is beautiful. Covered bridges and lots of green. Yeah.
So you have your own facility and et cetera?
We do. Interestingly enough, Dr. Block, as well as being a scientist, is also an entrepreneur and an innovator. And in 2007, we were given a grant by the state to start a biotechnology incubator. So we actually have 3 nonprofit organizations under one roof, and we live at the biotechnology center that we run.
I see. So how many staff does the foundation have?
We have 10 people who are dedicated to the public health programs. And then we have 1.5 people doing communications. We have 1.5 people doing events. We have a half a person doing the accounting. But the core group, I mean, we're less than 15 people.
Okay. But you do a lot.
We do a lot.
So tell me what you do. I mean, that's a big question. But go for it. Your presentation yesterday was very nice in that regard.
Oh, thank you. So we do public health research, and that is trying to uncover best practices and strategies for improving the entire cascade of care. So we'll try and design studies in different communities around the world that will help people get diagnosed, help people get treated, help people get access to care. We also do a lot of advocacy and policy. And I know you've spoken to Thomas about this. Hepatitis B is highly stigmatized and underdiagnosed. And so we do a lot of work trying to destigmatize and de-discriminate hepatitis B. So in many countries, if you're diagnosed with hepatitis B, you can't get a job or you can't immigrate. In the U.S. until 2012, hepatitis, you actually could discriminate against someone who had hepatitis B. Oh. You no longer can, thankfully, and we were very, very lucky to be part of that. So we do a lot of anti-stigma, anti-discrimination work, policy and advocacy. In the U.S., we do legislative policy, trying to make sure that there is always more funding for hepatitis B research and for liver cancer research as well. And we do a lot of capacity building. So we work with local community groups around the world to help them build their own capacity to test people, to do free testing in the community, to do their own community awareness events. We run a storytelling campaign where we train grassroots advocates and people with lived experience and empower them so that they can go on and educate people and become their own advocates. What else do we do? A lot of data collection and a lot of patient engagement. So we will do both quantitative and qualitative research to document the lived experience of hepatitis B, the quality of life indicators. And then we share that out into the community. And what we're really trying to do is eliminate hepatitis B, but do it from a people perspective. So What works? If you have hepatitis B, what is going on in your life? And what do you need from treatment? What do you need from doctors? What do you need for the future?
So it sounds to me like, I mean, you said the foundation is 15 people, but it sounds to me that when they start to reach out with these various programs, there's a lot more than 15 people involved. And these must all be volunteers in various communities and stuff.
A lot of them are small. They're community leaders in their own small organization. Some of them even are prompted to start their own little community organizations and grassroots organizations, and they are incredible.
What's your sense of the awareness of HBV and, the stigma and your mission, et cetera, in the medical community, both public health and physicians? Is this on their radar?
Not really. No. I think hepatitis B has always been thought of as a liver disease. And so among hepatology, it's pretty well known. But I think what we're all forgetting is it's also an infectious disease. It's an oncogenic disease. And in order to be diagnosed, you need your primary care involved, right? Because that's at the grassroots. And so, unfortunately, what we see, and there have been studies that just show very low awareness among most non-specialists around the world. And we're trying to do something about that.
So, do you have any idea? I'm just picking out one familiar community. Do you have any idea the prevalence of hepatitis B in the U.S.?
Yeah, so there's different estimates, and so you'll see a range. I think part of the problem in the U.S. is we don't have a national surveillance system for hepatitis B. That's kind of where I was going. Yeah, with this. There's no real funding for surveillance. There are a couple of sentinel sites around the country that are funded to do a little bit of extra surveillance for chronic hepatitis B infection, but ultimately it's very hard for us to say accurately how many people have it. What we rely on is modeling studies that are based on prevalence rates among countries of origin. And so right now we think there are up to 2.4 million people living in the U.S. with hepatitis B. Most estimates are somewhere between 1.5 and 2.4 million people with chronic hepatitis B infection. That's quite a lot.
Would it be, fiscally practical to screen the population?
What a good question. So last year, the CDC actually did come out with a new recommendation that all adults in the U.S. are supposed to be screened at least one time for hepatitis B. Okay. So it is cost effective because
I'd kind of like to get screened myself,
We can get you screened. That's easy.
So what is the screening involved? Probably just a blood test.
Right now it's a blood draw. It's the triple panel. So surface antigen, surface antibody, core antibody. Okay. And that's really nice because it tells you if you're infected, it tells you if you're protected, and it tells you if you're at risk for reactivation.
Yeah, I used to teach medical students, and I would teach this, and that was a great multiple choice question, right? Give them the various results and tell us what this person's situation is. Yeah. But now the U.S. must be globally very heterogeneous in terms of the prevalence. So like Africa, is that a hot spot?
It definitely is. And unfortunately, there hasn't been a lot of numbers coming out of Africa for as long as there have been numbers coming out of other areas of the world. So we have a much better picture of the prevalence of hepatitis B in many Asian countries. We're seeing a very large picture now of hepatitis B in Africa. And there are some places where 10 to 15% prevalence in communities. The problem in many of these countries is there's low diagnosis rates, right? Because it's not on the radar. So people aren't necessarily being tested. Often people are diagnosed with liver cancer before they're diagnosed with hepatitis B. And in Africa, especially among African men, people are tending to get liver cancer at a younger age.
Right. So when you try to reach out to these communities outside the U.S., do you get cooperation from the local health establishment or the government? Is that a problem?
It can be. Yeah. I think the communities are very, very motivated. They want to see more happening. They want to see access to free or reduced cost treatment. I think the governments, so the World Health Organization does now have a call to eliminate viral hepatitis by 2030. And some governments are actually taking that up. Unfortunately, what we're seeing are governments that are taking up elimination for hepatitis C and not hepatitis B. Mm-hmm. I think the lack of a cure is working against us a little bit.
So, where do you get your money?
Great question. We write a lot of grants. We have some CDC grants. We have a grant from the FDA now to do some work. Donations. We require donations, general operating support, just so that you can keep your lights on and pay your staff and do all the work that you need to do. We do fundraisers. We have 1 or 2 fundraisers a year, and we rely on the generous support of people who care about hepatitis B.
And you coordinate this meeting, right? That's
we do.
Basically an outreach project, I suppose. I don't know what bucket that would fit in, but
I think for us, part of our mission is supporting efforts that will lead to better treatments and a cure. So whatever we can do to bring the scientific community together and to support the sharing of data and networking between scientists, we want to do it.
So I want to back up a minute to sort of the prevalence thing, because there was a question I forgot to ask. In some of these areas where there's a fairly high prevalence, how much of an awareness is there in the community that this is an issue?
It depends on where you are in the world. In many places where hepatitis B has impacted generation after generation of families, people are very aware of it. So in China, for example, everybody knows about hepatitis B. The question is there, what misinformation is there? And so while there's often high awareness, there's low knowledge, right? And so people are often thinking hepatitis B is genetic because it's transmitted mother to child due to blood exchange. And then you have other places in Africa, for example, where there's less awareness about hepatitis B, but there's a lot of awareness about jaundice and liver cancer. And so what we are trying to do in some of those communities is help people make the link that hepatitis B can lead to jaundice and liver cancer.
Right. So I'm interested in the music business. We call it grows and glows, okay? I'm interested in, let's do glows first, what you think your best successes have been.
Oh, wow. Okay. Great question. I think in 2012, we were instrumental in making sure that people with hepatitis B were covered under the Americans with Disabilities Act. So here in the U.S., and it happens more than you would think, nurses, doctors, physical therapists who are fired from jobs because they find out they have hepatitis B.
That just blows my mind.
Yeah.
That's possible.
It's outrageous, and it still happens. The good news is now when someone calls me and says, I was just fired for having hepatitis B, or this medical school wouldn't let me in, I now have the law on my side, right? Okay. So we can actually help. So we were very, very pleased with that. That was a huge win for us. I think that also last year we were part of the World Health Organization committee to renew the WHO treatment guidelines for chronic hepatitis B infection. And so for the first time, we were able to bring the global voice of people living with hepatitis B and the providers who care for them. For us, that was enormous. And our storytelling program. So I think you were at maybe you were at the community forum.
I missed Wednesday.
So we had this community forum, and we bring people who have hepatitis B, and they come and they share their stories and they talk about what it means to have hepatitis B. And these are folks who are they're giving FDA testimony. They're writing blogs. They're speaking to journalists. In 2015, if you had asked me if you could speak to one person who had hepatitis B, I would have said no. So we started this Just Be storytelling program in 2015. And now, depending on where you are in the world, probably from 15 or 16 countries, I could find you hundreds of people around the world who now could talk about their hepatitis B.
Our experience in the science communication business has been that storytelling is really the most powerful way to communicate. Scientists are all hung up on having a lot of data and stuff, and a story is just an anecdote, but the stories are compelling, anecdotal or not.
Absolutely.
So, really important.
Thank you.
Other triumphs?
Yeah, I think legislatively, we have been able to increase federal funding for hepatitis B and liver cancer research at the NIH. And I don't have the actual numbers. We have a really lovely graph that shows that because of our advocacy, we've been able to see over $150 million increase since from 2015 to 2021. So that to us is incredible. And I think we're the only people doing that here. We're the only people who are bringing hepatitis B as a priority certainly to the U.S. federal government. So that makes me very happy. I can share one more, actually.
One more.
In Delta State, Nigeria, we just completed with the CDC a perinatal transmission program where we were working to improve birth dose, which was very successful, but we were able to use that and to leverage that. And we worked with the health minister. And actually in that state in Nigeria now, we were able to implement a policy that's anti-discrimination. So you cannot be discriminated against there. And they included hepatitis B screening, birth dose for babies, and treatment for free under their health insurance program.
Outstanding.
So hopefully that is a model that the rest of the world will uptake.
So what are the big challenges going forward?
How much time do you have? Hepatitis B is under prioritized. We need a lot more money to do more research. But more than that, we need governments who are committed to eliminating hepatitis B. We need treatment guidelines that make treatment accessible for every person who has hepatitis B because they are all at risk for liver cancer and cirrhosis. We need every person to get tested and into care. I think what we need is a community that is demanding action. We can't wait. Right now, we have about 1 million people dying every year from hepatitis B related disease. We just can't wait any longer. I think we have to we have to learn from the people who came before us and start demanding that we are prioritized.
Well, it seems to me, based on this, that the leadership is in place to do just that. Good for you.
Thank you.
Have we done everything? Anything else that you can think of that you'd like to emphasize?
This actually is incredible. This is very helpful to us because it gets the word around to people who listen to TWiV, and that's the scientific community is very important. I think for a long time, the scientific community felt that hepatitis B was a done deal. We have a vaccine, we have antiviral treatments. I think we're just now helping people understand that it's not enough.
No, it's just the beginning.
Just the beginning.
All right. Well, I've certainly gone to school. I really appreciate your time. This has been terrific.
I appreciate you. Thank you so much.
Good luck with the organization. I will be in touch.
Thank you.
Good.